Hi, everyone. Rob Palowitz, President and CEO of Palo Creative. And today we'll be looking to bring back bright smiles as we welcome Dr. Rudy Braydich of Braydich Dental. Hi, everyone. Let's please welcome Dr. Rudy Braydich of Braydich Dental. Dr. Rudy, thank you for joining us on the Game Plan for Growth show. We're in crazy times right now. What business looks like in all industries is way different than it looked like just a few months ago. So you as a dentist and a healthcare professional, what has this pandemic done to you and your business on how you've had to operate, helping serve your patients?
Well, thanks for having me on today, Rob. I really appreciate the opportunity to share what's happening in our business, the tooth business, so to speak. But things have changed quite a bit since we were told that we had to shut our offices down and only see emergency patients for the first 6 weeks of this pandemic. And the one thing it did is it slowed us down. Our cash flow went south, and it was a tough situation as we had to make decisions with 28 employees. We had to make decisions to furlough all of them, including two of our doctors. Okay, and so that was a very tough decision. Also, the concern was is that as we were in this 6 to 8 week period, what were we going to do in our office to make it more safe? Okay, number one, for our team,
Right.
okay, and also of course for our patients, who are our number one concern. So yeah, that's where we're at.
Yeah. So what do you feel you've done, early on when this came about that you feel was probably a good move, or something that can kind of help, that you learn from, that can maybe change the way you do business, or change or adjust your model to help your business?
That's exactly what we did. We adjusted our model. Mark and I looked at this as an opportunity. Okay, I mean, a lot of guys just went ahead and just shut their offices down. They didn't even keep their office open or anything like that. They just shut down. We decided not to do that. We decided to make this a learning experience for us. Okay, look deep inside the things that we basically take for granted on a day-to-day operation. Now we had the time to go ahead and look and see what was really working, what wasn't, what we
Yeah.
needed to put more emphasis on, and things like that. And so that's what we did. The slowing down process, we went to working only 4 hours a day compared to 12. Okay, so that
Wow.
really was a time for a lot of reflection and looking at the different things that we needed to do. We knew we needed to put in new safety practices, so we were pouring into the literature of what evidence and you know proofs and scientific evidence they had concerning COVID-19, which was limited. All right. So
Right.
basically, we're going on a lot of opinion and a lot of recommendations, no really strict guidelines or anything like that. So it's been a learning process through the whole thing. All right. And then taking that material and then communicating that to our team, letting them know that we're doing the things we need to do here while they're not here, to create a safe environment when they return. So it was a
Yeah.
challenge, it really was.
And then,
But
I mean, being you're in the healthcare, industry or in field, I mean, you're used to hygiene. You're in people's mouths every day and in front of people's faces. So, I mean, typically, you already have a lot of the equipment you would need, to keep, both the patient and your team, safe. So, have you had to do much adjustment with that, with the PPE?
the big thing, the big take home, I think, from COVID-19 is social distancing. All right. We know that if you are apart from people, you have less of a chance of getting it. And you're right. What's social distancing when I'm working in someone's mouth? That patient and I are easily anywhere from 18 to 24 inches away from each other for a prolonged period of time.
Right.
So we established protocols to go ahead and make sure that that social distancing was done. We go ahead and we ask patients a series of questions that have been recommended by our Ohio State Dental Board, which allow us to go ahead and determine if they've been exposed to the COVID-19, or if they've had relatives exposed to it, if they've been out of state or out of the country. And we ask all these questions. So we have screening questions right off the bat. If any of them answer yes to that, we don't see them that day. Okay,
Right.
they see their physician or self quarantine until they're okay. We also take their temperatures. All right, so we know that if the temperature is up over 100.4, that there's a chance that there's an infection going on in the body, and so we're just not going to see that patient at this time.
Right.
So fortunately, during this whole process, I can count on both hands how many people we had to turn away, and I still have fingers left over. So
Right.
it really was very minimal, which was encouraging, and we shared that with our team to let them know that we were moving in a very safe way. As far as personal protection equipment, which is PPE, you're right. We did very little tweaking there. We had to change our masks. The level 3 mask that we were using was an excellent mask. We use it on almost all of our procedures. Some of the girls are more comfortable wearing that mask, but they wear a face shield as well, which protects them from any aerosol or droplets. And then the other thing is that we also have N95 masks. Some of the girls are wearing coverings over their hair, okay, and also disposable gowns. But the gowns that we have been using all along, which are our lab coats, are sealed at the wrists, are sealed at the collar. So they have been approved to go ahead and as a safety measure. So the tweaking we did there was not much. We are concerned also about the air quality, okay? One of the things that we did when we opened up our new addition 10 years ago was we went ahead and put in UV filtering of our air, as well as
Oh, wow.
filtering too, okay?
Yeah.
HEPA filters and stuff like that. So we know our air quality is good. And every night we run an ozone machine in our office, which goes ahead and kills everything. So
Nice.
we feel very, very safe and very comfortable working in our environment.
Great. So pushing forward, then, how long do you think, not only just from a healthcare professional for any industry, what's your opinion on the length it'll take for us to kind of get back to a somewhat normal situation with, with business and, people having confidence and going back out in public and that sort of thing? What's your opinion? How long it'll take?
Mark and I belong to a study group where we have guys up in Michigan, we got guys in Arizona, all different areas. Like Arizona started up a little bit earlier than Ohio, and talking to him, he's full go. I mean, his practice is full. They're basically haven't missed a step or anything like that. We're
Hmm.
looking at here in Ohio, just thanks to you guys, you provided a survey that we went ahead and placed on Facebook to kind of get a pulse of what our patients were thinking as far as safety in our environment. Appreciate all that you did there. That was a great and very informative survey. Okay, and what that does is, that shows us that about 80% of the people, 85% of the people feel pretty confident about coming in. And as the communication was shared with them about the safety procedures, they felt that they even felt more comfortable. So we look at probably having a full schedule, but our big concern is social distancing. Our waiting room is not going to be packed like it was before. We're only allowing 3 people in our reception area at a time. If they're more than that, they're going to wait in their car and we'll just buzz them in. There's just different things that we have to do. Fortunately, our rooms are easily 10, 15 feet apart from each other. So we've got social distancing there, which works well. And by staggering the appointments, the people will be in and out without having to have minimal contact with people, which is what we're looking for too. So looks good.
Great.
Looks good. So we're going to see how June goes. I think June's going to be a pretty good month, and we'll see how July and August. But I'm probably thinking the middle of August we'll have a really good idea if we're moving in the right direction for 2020, or if this COVID thing is still giving us.
Well,
So we'll see.
great. All right. Well, that was a good segue then. I appreciate the kudos there. So with that, what have you seen? What have we done both, I guess the best for you, as you being a client and a friend of Palo Creative? How have we helped grow your business?
Well, one of the things is that you guys kept in contact with us. Okay, we knew that we weren't going to be able to devote the marketing dollars in that first 8 weeks and everything. You were very understanding and helping us go ahead and adjust our accounts so that we could go ahead and maintain our cash flow and keep things going. And you were always there to communicate with us, wanting to know what was going on, where do you see things going. And once again, our theme, for the next 90 days, probably 180 days, is safety. All right. And so you started developing different types of, I gave you information from different articles and things like that. And you were able to synthesize that into what I call people-friendly communications. Okay. So that people could go ahead and our consumers could go ahead and take a look at those things and feel confident that we were doing everything that we could to do that. So we appreciate all that you did in that. And I really like the post that you've been putting on our social media. The survey was awesome. It really gave me I really felt confident that we were communicating properly. And the key is that as we move forward, it's communication, communication, communication to the team as well as patients.
Awesome. All right. Well, Dr. Rudy, I appreciate you taking the time of your day to spend it with us here on the Game Plan for Growth show. And we want you to stay safe, stay healthy. And we appreciate everything you're doing to help patients with keeping their smiles smiling, right?
That's right. We got to keep them smiling. That's exactly right. And, to other businesses out there, I just say, just keep your communication lines open with your customers. Don't assume that they know what you're doing. Let them know what you're doing. And if you do that, you're going to have people at your door when you open. So just press on and keep fighting the fight. And we're going to beat this thing together.
Awesome. Well, thanks again, Dr. Rudy. That's great advice. And we appreciate you taking the time. And again, hopefully this will help some other businesses out there, push ahead, working through this pandemic. So you stay safe and have a great day.
And you too, Rob. Appreciate everything Palo Creative has done for our business and will continue to do. Thank you.
Thank you so much, Dr. Rudy. And this is your coach, Rob Palowitz. As always, thanks for watching the Game Plan for Growth show, and stay tuned for our next episode as we share with you the playbook for growing your business.